Risk factors of chronic kidney disease and kidney-friendly tips. Anyone can get chronic kidney disease at any age. However, some people are more likely than others to develop kidney disease. Factors that can increase your risk of chronic kidney disease include diabetes, high blood pressure, heart disease, smoking, obesity, being Black, Native American or Asian American, family history of kidney disease, abnormal kidney structure, older age, frequent use of medications that can damage the kidneys. Here are some kidney-friendly tips. Number 1. Keep your blood pressure below 140 by 90 mm of mercury or the target your doctor establishes for you. Number 2. If you have diabetes, stay in your target blood sugar range as much as possible. Number 3. Get active. Physical activity helps control blood pressure and blood sugar levels. Number 4. Lose weight if you are overweight. Number 5. Get tested for CKD regularly if you are at risk. Number 6. If you have CKD, meet with a dietitian to create a kidney-healthy eating plan. The plan may need to change as you get older or if your health status change. Number 7. Take medications as instructed and ask your doctor about blood pressure medicines called angiotensin-converting enzyme and angiotensin II receptor blockers, which may protect your kidney in addition to lowering blood pressure. Number 8. If you smoke, quit smoking. Smoking can worsen kidney disease and interfere with medication that lowers blood pressure. Number 9. Include a kidney doctor or nephrologist on your healthcare team. Subscribe to SF Healthcare for more informational content.